Thank you all for coming, even though it's a Friday evening. Thank you for making time for this program. And today's program is actually associated with the Connectors Workshop 2025, which just took place over the past 2.5 days. In today's program is called Public Engagement in Health, with panelists Ashata Dahal, Pattie Gonsalves, Tasha Koch, and moderated by Sarah Haider Iqbal. I request the panelists to join us on stage so we can begin the program.
A very warm welcome to this discussion, and thank you for joining us. And it's a very intimate setting and audience, so I think we can keep it interactive. Feel free to ask any questions, share your thoughts, reflections on anything. And before we kick off, I'm Sarah, first of all, and that's Pattie, Tasha, Ashata. And we will shortly hear more about the work they do and why they do what they do. But before that, I thought since we're so few, I would love to hear your first of all your interest in attending this session, and also just what's your relationship with health, given this discussion is about health engagement. So anybody would like to share their thoughts? And that side too. Sure.
Actually, I don't know if you need a mic at all.
Yeah, it is pretty.
I'll speak on behalf of everyone here, actually. We're all from the Ramlinger Swami Center on Equity and Social Determinants of Health, part of Public Health Foundation of India. So we have been looking for a reason to visit the Science Gallery. So when we saw this talk was being advertised, we're like, okay, that's a reason to visit now. So we had a good visit here at the gallery, and now we're really excited to be here for your discussion.
Wonderful. Thank you. And please, if you would like to tell us what is your relationship with health, other than working at Public Health Foundation of India. Personally, yeah.
Personally, I work on mainly adolescent health, sexual and reproductive health, and starting to, also in areas like migrant health and urban health and so on. So very broad based, but the underlying theme to all of these is looking at the social determinants of health rather than the conditions.
Great, thank you. Thank you for sharing that. Anybody else?
So I'm very new to the public health field. So I'm working currently on a project on maternal health. So,
Okay. All right. Okay.
Hello.
Hi.
I'm glad to be here and be part of this panel. I work on the health of the team here, so I do operations.
Great.
Hello, I'm Aishwarya, and I'm a public health researcher, and for 2-3 years now I've been working on maternal health, and I worked at the state health department, and now I'm working here as a researcher.
Thank you.
Hi, I'm Gayatri. My relationship to health is really looking at urban health, migrant workers' access to health, but also more methodologically speaking, looking at feminist approaches to health.
Thank you so much for sharing that. And I will pose the same question to our panelists too. And I would request you to not reveal what you do, but tell us how do you see your personal relationship with health? How would you describe it? So, Pattie, since you're next to me.
Thank you, Sarah, and hi everyone. It's very hard for me to answer that without revealing what I do. But I think for me, when I think about health, it's very personal, and there is the professional element to it as well. For me, whenever I think of health, the first thing I think of is mental health, and how my mental health has a big role to play in my physical health and vice versa. And also that my mental health and I would say my family's mental health was something that I understood from the lens of relationships, from the lens of how I grew up in school, how I learned, how I interacted with other people, etc. So every time I hear health, for me, the first thing is mental health.
Okay.
Hi everyone, it's really nice to meet all of you. So thank you for coming on your Friday afternoon. And I'm from South Africa, so it's very nice to be in India. It's my second time, but I've seen a bit more, being with Sarah and everyone else. It's a really interesting question because I never thought about it until Sarah asked us that. It's like actually insane working in health and not having asked myself that question. But I think I can position it in terms of how it's changed for me. So when I was younger, I saw health as very individual and biomedical. So it was, did I need to go to the doctor? Did I have all the vitamins that I needed? And now that I've grown up a little bit, I see it as much more of a community thing. So I see my health as being very much influenced by the people around me and the relationships I have. And I see it in a much more holistic way. So trending towards mental health, but I do believe that those things actually do influence your physical health. So a much more communal way of thinking about health. So whereas before I'd prioritize biomedical things, now I prioritize having community around me. And I feel like that keeps my health overall very good and very strong. Thank you.
Thank you. Hi, everyone. Good afternoon. So my relationship with health, I think, like Tasha, it has evolved over time. So for me, health was, first of all, I would go by the definition provided by WHO. It's like a complete state of physical, mental, and social well-being without any illnesses. But I think over time, my professional life has shaped my thinking about health as well. So now I see health as a collective effort. So it's not just about keeping our body free from diseases, but it's about it's more than data or interventions. So it's about dialogues that we do. It's about empathy we have, and it's more about co-creating changes together in the community. So that's how I see my health as now.
Thank you, and I can see you're like segueing into into my next question. But thank you so much for sharing that. And I think the reason I was interested in understanding this is because precisely what Tasha said, that I think all of us, I can now say, work in health. And we think that everyone is thinking about health because we are thinking about health. We're thinking about health in an evidence-based manner, but that's rarely the case because people don't have access to the information, evidence that we work with a lot of times, and they're not part of the process through which we're generating this evidence and creating this knowledge around health. Especially today, given we have very high inequities when it comes to health, especially in countries like ours, and South Africa, and with our colonial histories and various other issues, and I think because we think about health so much, we think everyone else is thinking about health, but no one is really thinking about health, I guess, the way they should be. And I think that's really where the role of public engagement becomes so important, is how are we allowing engagement with, or providing engagement with health and health research. And we, in fact, the last 2.5 days, we were at a workshop, all of us were at a workshop called Connectors, where we were talking about people who are making those connections between research and communities and health, science and society, and what sort of role they are playing. So I know that I have 3 connectors here, sitting here, who are trying to do exactly that, making health relevant, accessible, and meaningful to people outside of the formal health spaces. So Pattie, if I can ask you to maybe tell us a bit about, I know that you've not had a obvious, like, traditional path to what you're doing right now. So maybe talk a little bit about how you came to do what you're doing today. And then also tell us what you are doing today, about the various programs, projects, and how that's really enabling meaningful engagement with public and communities in India. So,
are we using any of the visual aids?
Yes, we will use the visual aids.
Thank you for the question. They are queued up. I can pull them up whenever needed. So for also maybe to speak to the students in the room and those of you in public health. So I did start out with a more kind of traditional journey. I was always very interested in mental health and psychology as a child. It's something that I saw in my family. It's something that bothered me because it was, for example, an experience that a sibling of mine had all through their kind of growing up, where I saw that if now I reflect back, very simple interventions like feeling accepted, like being able to talk to somebody, being able to just access a little bit of mental health support could have gone an incredibly long way in helping this young person shape their life. And when they did access that support later in life, it was just pivotal in kind of transforming them. So I started out studying psychology, and then, much like most of you, actually studied public health and was also at the Public Health Foundation of India, so some potential camaraderie with colleagues here. And then moving back to psychology, but in the middle doing a lot of work with music, art, theatre, mixed media, etc. But constantly in that phase being told, it's not good to be a not serious researcher, it's not good to be a jack of all trades, where do these kind of creative pursuits fit with this, serious health job that you should have, etc. Fast forward to a little bit later, or I should also say, feeling at that point like, some of these interests are quite incompatible. But again, fast forward later, I think the fact that we're sitting in this building and this room is a testament to the fact that that view has shifted and changed, and people and institutions are bringing kind of science, communication, art, and this different kind of meaning making and story telling together. So I have to say I feel a lot more comfortable in my skin now, but it was definitely a very uncomfortable journey to get there. I work with an organization called Sangat. Sangat is a mental health research and community focused organization that started in 1996. It's headquartered in Goa and has project sites in different places. I'm based in Delhi, and I work specifically on children and young people's mental health, both on the research as well as the engagement side. I know we will talk more about this in subsequent parts of the discussion, but of how these are not necessarily these discrete ideas, but how we are bringing them together. At Sangat, I thought I would share with you just one short video and a couple of examples of what science communication and public engagement looks like for us. And is it okay if I start with the PDF? And I'll maybe close with this. There's some pictures and no problem. So maybe while that shows up, the first image that you see there, it is the evolution. It's something we've been discussing over the last 2.5 days in the workshop that we were doing at Science Gallery, which is also this kind of the idea of reconceptualizing what we think about when we talk about public engagement or community engagement. And originally it was always thought of as this extra thing that researchers would add on to a project because they felt that there's these very complex findings or very dense information that we have an ethical obligation to communicate that to the public or audiences or to a funder, etc. And that idea has really shifted to saying now that it is becoming kind of inescapable and vital to involve communities who will benefit from that work or who are the end users of that work, really involving them right from the start of conceptualizing an idea down to, in certain health fields, particularly in mental health, for example, I would say it's much more accommodating to include service user and community member or families, lived experience individuals into the design process of mental health interventions, into how research studies are conducted, and even how treatments are delivered, when many members of the community now are involved in offering first-line interventions for depression, for anxiety, suicide prevention, and so on, down to the more kind of traditional end of the circle, which is the things you expect to see, which is, kind of public and outward and external facing outputs. If you go to the next slide. Now, these are 3 quick examples that I'll share with you. As the name suggests, the first one, this is an initiative called It's Okay to Talk. It started in 2016. Again, it was actually born out of a large research program that was offering counseling to students in schools. And we thought we had done a really fantastic job of putting this counseling program in the schools, and then realized that nobody was actually coming up and asking for or signing up for the counseling. And that's when we established this initiative, which, as the name suggests, is really around building conversations, opening up dialogue around mental health, and really promoting the idea that it is not just important, but really essential for people to talk more openly about mental health and mental health problems. Moving along there, building on this initiative, we now also have kind of similar programs focused on student suicide prevention. And most recently, it's actually part of a large randomized control trial, but it's a peer support initiative for college-going students, and it's placed on their campuses. Next slide, please. Or is it okay? Sorry, I'm going to scroll the website. I just thought I'd quickly show you some examples here of. So It's Okay to Talk is it's a website that, again, as I was saying, the name suggests, we realized, and you will see kind of storytelling and stories in general being used as a really important tool across a lot of public health issues. I'm sure many of you either use this or have encountered this. This is a website that we launched in 2016 that shares young people's stories of different mental health experiences from around the country. You can sort of sift stories here, select things. There's a tool to tell your own story as well. And in the story section, we worked over the last couple of years in particular on really trying to personalize the platform as possible, allowing users, particularly again young people, to be able to really find stories and topics that resonate with them. Another one, building on our storytelling, it's a project called Man Mela. For those who don't speak Hindi, Man Mela kind of translates to Museum of the Mind. This was actually meant to be something that would happen in a gallery like this, where people could come in and interact with others' experiences of different kinds of mental health challenges, specifically focused on highlighting social determinants of mental health and not just kind of direct illness narratives. So these are very highly produced sort of mixed media stories of 9 young individuals from around the country who have very, very kind of rich and diverse experiences of mental health, both personally caring for family members and with regards to their identity. And as part of this, there's a range of different video and downloadable resources. I'll show you one example at the close. There's also a podcast from kind of stories we were recording during the pandemic, and lots of art that people have shared with us that you can access. Here, this is one more example. And the third one, which was in the deck, it's an initiative called Outlive. It's really targeting students on campuses in India who experience suicidal thoughts or ideation. I'll skip all the way to the end, maybe. Yeah. Which reaches students through a range of activities like you see here. So in person, distributing materials. Next slide. Through a chat-based platform that links students with crisis support. And also has kind of advocacy building initiatives. So students who may want to kind of take it a step further and they want to learn how to actually work with legislation related to health, and in this case specifically suicide prevention. The last example is a program called Sathi Support. I'm just going to show you some of the visuals. These are therapy booklets that were designed over a year and a half with students from universities in Delhi. And finally, these are some of our recruitment materials for a trial that's ongoing right now. I'll close with a video, which is just, it's 1.5 minutes. It's a really old video that we created in 2016, 17, that when we looked online, we were trying to find an explainer video for just a definition of mental health in Hindi, and we just couldn't find one, so we decided to make one at the time. And before showing you that, I think one of the things to say, the circle that I showed you at the start, that has been the approach to design all of the examples shared. The website you saw with the stories, it's something we worked for about 2 years with students, young people from schools, colleges, and kind of community NGOs to really design that. The artwork is designed by young people. Even the selection of kind of tagging of themes and stories and so on is done by young people themselves. And I'll close with this. It's just an example of a video we wanted to create, and it is an animation intentionally because we wanted people to be able to just take the visual and then put any kind of audio on top of it and use it in different languages.
मानसिक स्वास्थ्य क्या होता है? हम जब मानसिक स्वास्थ्य की बात करते हैं तो मन में तनाव, बेखुशी या गम जैसे फीलिंग्स आते हैं, या फिर डिप्रेशन और बाइपोलर डिसऑर्डर जैसे मेंटल इलनेसेस के बारे में हम सोचते हैं। हमारी जिंदगी में कई उतार चढ़ाव होते हैं और हम हर दिन नए प्रॉब्लम्स से जूझते हैं। प्रॉब्लम्स जैसे फ्रेंड्स हमारे कपल का मजाक उड़ाते हैं, किस टाइप से सुननी चाहिए। कभी-कभी हम ऐसी फीलिंग से डरते हैं, शर्मिंदा होते हैं, लेकिन हमारा मानसिक स्वास्थ्य बहुत जरूरी है। चलो इस बारे में मिलकर बात करते हैं। आज तुम कैसे हो?
Great. All right. Thank you so much, Patty. It's wonderful. Thank you. I think we'll talk more about the process behind all of this wonderful work. So, Tasha, would love to hear from you what the story behind your journey into public engagement. I mean, you are a biomedical researcher who's now doing public engagement. So, tell us a bit about how you got there and also the amazing work Woza does.
Thank you. So thanks, Sarah, and also amazing work, Patty. I have slides as well to give you some images, and it will also let you see some of the context in South Africa, which is similar and different. I'm also going to stand here because I think it will make it easier. While we're getting the slides up, I'll talk a little bit. So I trained as a molecular mycobacteriologist, so a lab-based tuberculosis researcher. And while I was doing my PhD, I was spending many, many long hours in the lab, sometimes even shedding tears because my experiments weren't working. And I was investing all of this time and effort, and I realized that I hadn't, that's the one, yeah. I hadn't actually met anyone who had TB, and TB is the biggest killer of South Africans of any disease. And that showed me two things. The first is that TB is a disease of poverty, and South Africa is a completely unequal society. I come from a privileged background. No one I had known had ever had TB. And the second thing was when I started, so this was in 2013, in the institute I work in, there were no spaces for biomedical basic scientists to engage with people who are affected by the diseases that they were studying. So there were lots of students who were studying HIV and TB and other relevant diseases. And so a lot of things happened at the same time that allowed me to move into community and public engagement. My research supervisor came into the lab one day and said, we've got a little bit of money for community engagement, let's print some pamphlets. And I was like, it's 2013, surely we can do something a little bit more creative if we're going to be engaging with people. And within the same week, I met an artist informally, and I was ranting about this, and I was saying it's so ridiculous that it's 2013. And through those conversations, we decided to have a health workshop with people living in a place called Khayelitsha, which is a township in Cape Town. And I told the artist, we're going to give these students some presentations about TB. Can you film us, scientists, giving these presentations, and we can give it to the students on a DVD? That's how old this was. We were still on DVDs. And he said, Tash, that is the most boring thing I've ever heard of. Who wants to give a kid a DVD with you giving your presentation? Why don't we give you a health workshop, and then let's film the students and understand what their perspectives of TB and infectious diseases were. So that was our first project. I can change, thank you. We then continued developing projects. I was going to become a biomedical researcher on the academic career track, and all of the projects that we ran from 2013 to 2019 were informal, and they were housed within the university, and they were all passion projects, mostly supported by the Wellcome Trust, who's invested heavily in the public and community engagement field. And at some point we approached, and all of the projects had a common theme, to engage people who were affected by the diseases that we were studying with biomedical research, and then to translate their perspectives into media that could be used to raise awareness, both within their communities but also within the broader public. And in 2019, we approached Wellcome and we said, we've done all these distinct projects. What is your advice for bringing this work together? And they invited us to apply for a discretionary award in public engagement, which we did through an independent NPO. So that allowed us to move from being outside of the traditional university environment into being an independent organization, which was very transformational, because it's one point that I'll make around community and public engagement, sometimes working within a formal big institution is very difficult because you can't move as fast as the community needs you to move to be responsive to their needs. So the organization that I run is very small. We're only 6 people, but it allows us to be very agile. We're not bogged down by bureaucracy and permissions and politics, institutional politics, which exists everywhere. So that was very transformational for us. So what do? We operate at the intersection of youth advocacy, science communication, and skills development. And we aim to bring together the biomedicine of disease with its social impact. We see our participants as active partners, and I think that's very key. We have to see the people we're working with as partners, not as top-down. I feel I learn as much from the people I engage with as they may learn from me. So we call it epistemic humility, where I come from, and in the circles that I develop this work with. And over the longer term, we hope that this will encourage positive health-seeking behavior, engender trust in health research, but importantly also in health interventions. And we saw how important that is during COVID. I mean, we saw how important that was during HIV, and then we saw how important that was during COVID again, that we learned to make people, that we develop trust with people so that they trust our interventions. And then infectious diseases like TB and HIV in South Africa are heavily stigmatized. That's changing, but stigma is still a really big thing, and as I understand it in India as well. Quickly, this is our team. We're very multidisciplinary. So the co-director of Woza is that same artist that I spoke to in 2013. So we built this together. And I like to show everyone because all of the work is a result of team effort. And then we've got lots of funders and partners and well, not lots of funders. I wish we had lots of funders. We have one key funder, which is the Wellcome Trust, but lots of partners. And I always say that support, money is really important and funding, but support also comes in other ways, especially in this kind of work, because the ideas and the relationships that you develop really help forward the work. So I'm going to skip through these slides and I'm just going to show you our programs. So we have, I'd say, 6 focus areas. In a big institution, these would be seen as departments, but we're not big enough to have departments. The first one is the program that started in 2013. So we did that project where we made a film about young people, and then we changed it to a participatory documentary filmmaking project where we recruit learners. So we recruit 12 to 15 learners a year, and we do this in a screening and celebration of the previous learners' accomplishments. Importantly, we want our workshop program to be fun. We're working with young people. They get bored really easily, so we do a lot to make it fun. Learners are not selected based on academic potential, but a willingness to take part and to tell stories. Then we do science workshops at the Institute of Infectious Disease and Molecular Medicine in Cape Town. So we bring the learners into the lab. Some of these learners come from very underserved backgrounds, so many of whom would never have even stepped foot on a university campus. So for me, it's more than just the information. It's about the access and making people feel like this space is for them as well. And then we cover a variety of topics in our science workshops. And then we move into a media production phase where we train learners to film on industry level equipment, so they gain that skill as well, and they capture stories from within the community about infectious diseases. And it's really interesting for the group that's from the Institute around social determinants of health, because what becomes very clear from these films is that we may start with TB, but TB is not just about TB. The stories always come back about being a range of factors which are social determinants of health. So it's made me see that we cannot, biomedical researchers want to talk about TB as an individual issue, but TB is mental health, TB is employment, TB is gender-based violence, TB is having proper access to food. We can't talk about these health issues in isolation. It's not just one thing, and that extends to the other diseases. And then really importantly, the learners edit their films. So that's really important because often the footage is taken by participants and then given to someone else to edit. And when you edit a film, that's where the narrative develops. It's in the editing, cutting up the films. And so teaching the learners to edit means they retain editorial control over how the story is told. So it's not me, I'm technically an outsider in Kailicha, right? I'm privileged, I'm white, where most of the population are black, and I don't want to be telling other people's stories. So we are very firm that the learners edit the films, because otherwise we will be telling their stories. So I'm not going to take up too much time just to say that these are our other programs. And if you are interested in any of them, I'll be around probably for a bit after the talk, or you can check out our website. So I'll just run through these very quickly. And I'm just going to end off. I probably won't show you the whole thing, but I'll end off with a few snippets of a film that we made. This film was from a new project. Khayelitsha is very urban, and we've recently started working in a rural area. I will just show you the first minute or two, just so you get a sense of South Africa, and then I'll stop and hand over to our other colleagues.
At the same time, environmental temperatures may cause a problem to izulu, ududume, unethe, imvula engakwazi ukulawuleka because of i-damage ezenziwa ama-seed.
I-challenges ezinazo apha ekalamba sithole nzima ukutsala kamanzi. Umandisi wakha kude, kwenye ixesha sifike emdaka exovwe zinkomo ngakuyapho. Sibuye futhi sibe nengxaki yomgwaqo. Umgwaqo wetyakimpikisa xa kunethapha endlini edolophini. Sibuye sibe nengxaki yee-colleges asinazo. Izikolo abantwana baphela grade 12. Njengoba abantwana bephuma late esikolweni, bayaleyithwa, bengaleyithwa babahlali baselambani.
So I'm just going to stop here. If anyone wants to watch it, the films are on our website. So thank you.
Wonderful. Thank you so much, Tasha. I guess we'll take our seats again. Ashata.
Sorry, I don't have good presentations like my friends did, and I don't have videos either. So I'll just dive in. I'm Ashata, I'm from Nepal. And how I got into public engagement is, I think I got it by accident. Nepali parents want their children to be either doctor or engineer and blah, blah, blah. So I always aimed to be, or I always aspired to be a doctor since my childhood. But then things didn't work out, and one of my relatives told me he gave me an option of choosing public health. And with blank slate, I went and got admitted myself in a public health college. Till then, I was very sad about not being able to be a doctor in future. But then, when I went to the villages of Nepal during my academics, so we had to do these field visits while doing my bachelor's in Nepal. So when I went to village, I saw, I was privileged one. I was studying in Kathmandu, the capital city, where I had easy access to hospitals, where I had easy access to health services. But then the people in those rural areas had to walk an hour or two to just to get basic health services. So that motivated me to think myself that, okay, I didn't do a bad thing by choosing public health. And then after my graduation, I started working in another rural village where for WASH, it was Water and Sanitation Project, where people had already landed moon, and there I was teaching Nepali citizens to build toilet and motivating them to defecate in toilet. So that's how my engagement process started, I think. So it was 2013 when I did such things, and then in 2018 I joined a clinical research unit called Oxford University Clinical Research Unit, and that is in Kathmandu, which does lots of clinical research in infectious diseases, antimicrobial resistance, and we have slowly started doing our work in climate change as well. So I'm not a researcher, clinical researcher, but I work as public engagement over there. So my job is to bridge the gap between the researchers and the community people. So there are lots of clinical researchers going around in Nepal these days. With the increase in infectious diseases, there will be more clinical researchers and more clinical trials, we hope so. So my job is to kind of bridge between the researchers and communicate the research to the general public, to the students, to the youth groups and other stakeholders, and also listen to what people perceive research as and how we can motivate them to participate in research. Because in Nepal, whenever we talk about clinical trials, whenever we talk about research, people think like we are doing some experiments, we'll be taking, we are working in lab, wearing lab coats, working with guinea pigs and all, so that kind of perception people have, and that's what I think with public engagement, I'm trying to debunk that myth, and I'm also trying to listen to their queries, listen to their concerns, and trying to address whatever concerns they have regarding clinical trials. So that's what has motivated me to go forward as well. And I'm also an aspiring social scientist where I'm trying to explore all this perception and trying to design the relevant engagement strategies to cater these population. Yeah, thank you.
Thank you, Ashata. It's really fascinating and very inspiring. Thank you for sharing that. So I think all of you have touched upon why what you do is important, and I'm sure, I think the audience gets a sense of why public engagement is important, I think, in your respective areas. One of my family members had asked me once, he said, there's information available everywhere, you go on internet and you can Google any health or science related information. So what is that you guys do? I mean, why are humans needed? To provide this information or to answer queries, and now we have ChatGPT. So I think I would like you to unpack a little more the role of public engagement. How is it? What role is it playing? Like good public engagement. What role is it playing in your respective areas, whether it's mental health, TB? AMR and malaria. What do you think? What gap exactly is it filling? Is it on both ends, on the institutional end, your institutions, as well as in the community? So whoever wants to start first.
So I think also a big question. What comes to mind very top of mind is it builds trust, which I think is really important. So yes, people can find information online, but I don't think anything beats human-to-human interaction. During COVID, there was a lot of people have become interested in digital interactions, which I think is good for productivity. But when you want to build trust, particularly with communities who have been marginalized and are already skeptical of the formal system, I think human-to-human, and even better if it's possible, peer-to-peer engagement helps to do that. So I think that's one part of public engagement, is building trust. And then I think it would be similar in the Indian context, but in the South African context, it also allows people who have been traditionally left out to participate. So I know just informing is not enough, but informing is the place to start. So if people don't know what TB is or don't know what a vaccine is, so in my context, many of the young people we work with, if you ask them what a vaccine is, they confuse it with an antibiotic. If they don't know what that is, they can't even start to participate in the discussion around vaccines or make choices around vaccines. So I think even just the bare minimum, even if you're not setting out to build trust, and that your bare minimum is informing, for people who have been left out of the conversation, I think that's very powerful and can allow better participation. And there's many more things that I know my colleagues are going to say.
Pattie, you mentioned that you started It's Okay to Talk as part of a research project, as part of a research program. So how is public engagement also informing research, or how is it shaping and influencing research? So if you could talk a bit about that as well.
Sure.
In addition to anything else you would want to.
I'll maybe first build on this trust point, because it's a really important point, and I think one must never kind of ignore the elephant in the room, that people don't trust a lot of health research, because it was really and continues to be still in many places and ways quite exploitative, extractive. It really isn't accessible to the people accessing that health service or medicine or drug or whatever. So there's a history of that there, you can't ignore it. And when, at least for me, the definition kind of changed. It was, I always thought public engagement is with research. It happens at the end. You take something and find a way to produce it in a more kind of engaging way. But changing the public engagement with research to public engagement in research, which was that first it was a really big mind shift. And I remember the first time being in kind of these, I don't know how many of you have worked in this kind of human-centered design, user-centered design, person-centered design, whatever term you want to call it, and feeling really out of my depth and thinking, how many times I'm going to repeat the same cycle again and again and again, is there ever going to be an end? I can't see the end output. And kind of constantly being reminded by the person who's leading that exercise saying, you just need to trust and wait, it will happen. But we might have to repeat this 20 times till we kind of get it there. And that mindset shift, I think, is the one that often people and I would say researchers in particular struggle a lot with, because you're just told that things happen a certain way and it's formulaic. So that mindset shift was the first one. Something that's been really kind of transformational, and now people are documenting these results. If you do actually involve people and end users in the design process, your health program can be a lot more cost effective. It can be actually a lot more effective as well in terms of the outcomes that you're looking at. It can be a shorter kind of development cycle, even though what I said before about the 20 times, you could not do that, design something, roll it out, it's a mega flop, and you're back to the drawing board. So those kinds of shifts are being documented, and I think it's helpful to convince people that this is a useful process. But somewhere, I think going back, the mindset shift, which is it's also saying people have the right to be involved in making choices about the healthcare that they will receive. And for those of us, I think, who work in this, it is really beyond the research. There's a political aspect to it, there's a human rights aspect to it, and you can't shy away from that. So yeah, I think I would really emphasize it's this mindset shift, and you have a lot of information and tools, but shifting people's perspective on the fact that this is something that's really important. People need to be involved in designing healthcare solutions, the people who will receive the healthcare solutions. That has been the biggest and continues to be the biggest challenge.
Thank you, Pattie. Ashata?
Yeah, so lots have been already talked about trust, so I will not go into that. But I would like to answer this question with an experience that we had faced in Nepal. So there was a government-led mass drug administration for lymphatic filariasis a few years ago in Nepal. It was a government-led. People do have trust on government at that time. But what resulted was people, the female community health volunteers distributed those medicines, going to each and every household, and then still the consumption rate, the uptake was like less than 10% kind of thing. So people started digging over. The government spent such huge resources over the mass drug administration, but then the result was so low, lower than what was expected. And then what was found out was that there was not any engagement done while distributing those medicines. The female community health volunteers, they just went to the home and they gave those medicines, didn't say about any side effects, didn't talk about when to have that medicines, didn't talk about who were supposed to take that medicines, the pregnant women, they were allowed to take that or not. After having medicine, like at what point of time they were supposed to take those medicines. So such kind of things were not communicated to them. That's when, like, there were few cases of vomitings and false rumors spread very fast. So those rumors spread widely, and people thought those medicines, the mass drug administration was actually an experiment, so they didn't bother to take those medicine. So that highlights the importance of engagement. And I think answering to your question, like what feedback does it give to the researchers, is like, I think the researchers are responsible to explore what community perceive research as, and I think that's when community engagement plays a role to bridge that gap. Like I've always been saying, like community engagement plays that bridge between the researchers and community, so that researchers can know what actually exists in the community, and then they can implement their research catering to the needs and concerns of those communities. So I hope I answered
very
your
well.
question.
Thank you so much. And yeah, that was a very, very powerful example of why I think meaningful and intentional engagement is important. I think I'm going to open up the floor for questions. I do have a couple of more questions, but I think I will request the audience if they have any thoughts, reflections, or questions to share. Do you want to say something, anyone?
I'd like to hear your views on, data. A lot of newspapers, for instance, have like the Hindu, for instance, has a little daily data section, but it's about health, education, the economy, and so on. But people don't understand data very easily. So I would want to, unless you've had some specific training, or unless the imagery is done so well that anyone could understand it, and that's not always the case. But I think that also drives a lot of people's decisions about whether or not the data, whether the information is trustworthy, whether it's serious, whatever they're trying to figure out based on the data. How important, it obviously is important, but how does one present data in a way that people can understand?
Yeah, that's a great question. Thank you for.
Thank you so much for your question. I think data, rightfully said, so everyone don't understand the same language, and everyone can't understand the p-values or the percentage and all. But I think that's what, for the past 2.5 days, we talked about language, how important language is in communicating the result. There are certain sections of people who understand those percentages, but the research that we do or the health projects that we do are especially for the beneficiaries, who are the community people that we are talking about. So yes, percentages are not understood by everyone, but there are other visual methods of making sense of those data, so that the beneficiaries, the actual beneficiaries, can understand. And like Pattie showed or Tasha showed in their videos, those data can be easily illustrated via pictures or diagrams or videos that are easily understandable by community people who are supposed to really uptake that information. And good data don't flow, but bad data or the false rumors they easily flow. For example, when we were doing a vaccine clinical trial on typhoid vaccine study in Nepal, we were supposed to vaccinate 20,000 children. The vaccine was easily available in the market. The people had to pay for those vaccines and get their children vaccinated, but a daily newspaper, a national newspaper, in their front page in bold handwriting, they published a news saying that we were experimenting on people's lives, and that caused a huge chaos while we were doing that trial. Though the vaccine was already pre-qualified by WHO, it was licensed by the local drug administration in Nepal. It was readily available in market. We were just doing a study on the vaccine efficacy, but then that newspaper stirred a lot of conversation in Nepal, and that's when public engagement stepped in, and we made people understand that the news was not to be believed, and the vaccine was actually safe to use because it was already WHO pre-qualified and such things. So yes, data, not everyone can understand. It is to be presented in a way who our audience is and who we are catering to. Maybe Tasha and Pattie can add.
I think you've covered most of it, but this is an example, and I do think this newspaper should just stop publishing some of these like graphs and things because I don't actually think they're really helpful. But just to say, I think data and the numbers, it can give somebody who's reading an indication of a direction, but it's not really telling you what's happening. It's not telling you the kind of giving you a sense of the picture. And that's where tools like stories become really, really potent and powerful, and also obviously can be potentially dangerous. But something that, for example, as a newspaper that we get in, you get it everywhere, but in at least a supplement that comes in Delhi on the weekends, on a Sunday, they have like this 2-page layout that's just on health, and it covers mental health, cardiovascular health, cancer, etc., etc. And there are kind of patient or user, family member, etc. perspectives, and it's quite powerful to see that. I think journalists are also starting to see that as a much more potentially helpful way of presenting health information. And another example maybe to share is on the point of stories. Something that we've seen is actually sometimes it could be reading a single story, it just needs to resonate. That's enough to actually help someone figure out, okay, this might be for me, maybe I should try this kind of a health seeking strategy, or I'm not alone in this experience that I'm having of whether it's mental health or other problem. And there are some studies, including one that we did, where we also wanted to see how many stories, for example, does somebody need to read or watch in order for it to kind of change their either like a health indicator. So it could be, for example, we measure things like levels of symptoms of depression or anxiety, their level of hopefulness, etc. And we've seen all of these metrics kind of went up. We saw similar results from other studies in other parts of the world. Again, I would say it comes with the caveat that presenting really, incorrect and like misinformation has the same potent power. Being one bad story, like you said, it takes one person to plant that kind of thought. It can have the same, and you can then have to do loads of public engagement to change, public opinion
Perception,
or something like that. But yeah, both are helpful tools. But yeah, I suppose it needs
you have to use it well.
Very carefully. Yeah.
Tasha, do you want to add anything? I also wanted to actually share an example. There is this artist called Green Humor. Have you heard of Green Humor? And he publishes a lot of very interesting artwork in Hindu, I think Hindu. Hindu is a newspaper in India. And he sort of distills latest research in ecology and biodiversity, environment. And all his cartoons are actually based on research papers. But when you read them, because he uses a lot of humor, it's very engaging. You get the message, really well. He also adds data in some of those stories. So I think maybe those are also formats we should consider when we are presenting data. As think outside the box, perhaps. But yeah, I think those are really, really important points that Pattie and Ashata have shared. Any other thoughts, questions, reflections? Yeah.
Thank you. My name is Vinay. So sorry for joining late hours, but I'm listening. So good to see all the panelists discussion. So I have a couple of questions. So one thing, definitely you guys are doing a lot for the public engagement. So I wanted to know during COVID-19 where everybody was locked down in their respective homes, how did you overcome the challenge and how well you were able to engage with the public? And one more common thing what I observed is newspaper. So a lot of things have come up on the engagement on the vaccination and everything. So how did you overcome the challenge? And did you ever try to come across having engagement with the journalists where they can spread the awareness for others?
I'll go for this one. So I don't know if, I think maybe you weren't here at the time in this talk, but our organization in South Africa basically started on the 1st of January 2020 and we locked down on the 15th of March 2020. So it was really interesting. So during COVID, what we did is we moved most of our work online, but I have a feeling it was the same in India, but you can correct me. In a place like Kailicha, which is an informal settlement, a township, you can't lock down. You can't lock a community like that down. It's impossible, right? People don't always have somewhere to go. And even if they do, it's just, unless you bring in the military, you can't lock a township like that down. And so what we did was we were focused on TV, but because COVID was such a big issue, we started working on documentary films about people's experiences of COVID in the township. And it was the first time that we were the first to document that, and it went on the news and stuff. So we brought those people's perspectives into the fore. And then the second thing is we started an animation program because we couldn't work with people in person. So we developed animations that we could then disseminate electronically, that could inform people. And we only started that for COVID. We continued it afterwards, but it's not something we ever really wanted to do. But we started it in COVID and then continued it. That's just two reflections of how we adapted. But I said earlier, I prefer not working online. I think it's much harder to build trust between people so I was very happy when things opened and we could go back to in-person programming.
Thank you for that question. I think in Nepal things were a bit different because in a resource-limited settings like Nepal, where not everyone had access to internet or not everyone had access to smartphones or laptops, doing public engagement during those times were really difficult. We tried setting up Viber groups. We tried doing virtual engagements via Zoom, but then it was not what we expected. Yeah, and I also prefer in-person engagement than the virtual one, but I think we need one thing about working in public health or public engagement is being flexible as well. So make the most of the resources that we have and go with the flow. And soon after the lockdowns and the restrictions were loosened up or they were lifted, that's when we started doing our engagement again. And talking about the newspaper, working with journalists, I think at Okra, Nepal, after the news the news article that I shared earlier, after it was published, we felt like the journalists were also one of the key members with whom engagement had to be done. So we had a series of sessions with journalists named Science Meets Journalist, where our research experts would go to a group of journalists. We had organized a series of engagement events with them where the journalist asked questions to the researchers, their burning questions, and researchers actually answered their questions and concerns. So that's how we worked with journalists, and we have tried to maintain that network until now, so that one of the things that journalists pointed out was while writing health news, they didn't actually have any source who to go to contact about any health issue. So I think that's what the network we have established. We are trying to be that link where the journalist can come to and ask the researchers about what exactly that particular topic means. Yeah, so that's, I think I've addressed you.
I'll just share a couple of examples of things that maybe still have relevance now that the pandemic is over. And I'm sure you've all heard this expression many times, that COVID shed a light on the problems that were already there and that perhaps we just didn't pay as much attention to. So some things that I think worked and many that didn't. So in the pandemic, because we are already an established organization, we had service providers as part of our teams, etc. We said, what are some ways that we can help? And one, for example, was to set up a helpline. And it was done in two ways. We set up a public helpline that ran till last year, and we received a lot of traction on the public helpline that primarily adults accessed. We also partnered, for example, in Delhi, where I work, with the Delhi Commission for Children. We received no calls through that helpline. And what that also told us was that, children firstly, they didn't have the information, and secondly, they actually didn't have a place or a way to call, even if they wanted to, or the safety to make a call. And it was being offered in multiple languages. It was like many hours of the day, etc. So that's one example. Another is we were, just before the pandemic, I would say not just us, globally, there was a lot of enthusiasm for digital health interventions, and that, these were just going to blow up and be the next big amazing thing. And they are in some ways currently, but there's also a huge divide in who's accessing these technologies and who isn't. We were meant to start recruiting for a trial that was offering a kind of a video game to students in schools. And we used to offer that video game. It was teaching them some kinds of kind of coping skills. We were meant to offer that in person, and we just assumed, it's fine, they can access it from home, we'll send the link, go use Kar Lenge. Nobody accessed the video game at all. I think there was one trial participant, and we were meant to recruit a few hundreds. Again, really, I would say it shed a light on the fact that children just didn't have, especially school-going students, they still do not have that kind of access. And these are particularly students from lower resourced school settings, government school settings. Those are, I think, two examples where the learning from there still holds today. I think those are also lessons we perhaps wouldn't have learned in quite the same way without the setup of the pandemic. A couple of other things that we were able to do through networks we have is people who did access technology a lot, they were asking for support with fairly kind of basic things like how to sleep, how to deal with feeling lonely, how to deal with violence that they were experiencing at home because they were kind of locked down with abusive family members or partners, etc. And we were able to have a lot of dialogue and discussion on topics like that. And the last example is the one that I shared, which is we documented about 100 different people's voices of service workers in the pandemic. So gig workers, delivery workers, doctors, nurses, etc. And the purpose of doing that is, and I hope, that many of us who did it, we still can't listen to the episodes, to be honest, because it's that difficult to hear back. Okay. That it's to not forget how, not forget the kinds of decisions we made, many that I think we all agree we shouldn't have made, like shutting down schools, and to have a moment to really reflect and think, when the next pandemic happens, how are we going to respond differently? So we really wanted to kind of capsule that moment, and hopefully there'll be a time when we can listen back to many of those voices soon. But I think when we think back on the pandemic, it's really to reflect on what we should do differently the next time, because there's going to be, there will be a next time, hopefully not in the same way.
Thank you. You also spoke about journalists. One of the organization I was working with at that time, we sort of partnered with a couple of other health organizations, and we started webinars for journalists. In fact, we were probably the first ones to have started connecting journalists directly with virologists and public health experts and the rest, and definitely saw a huge difference. And I think journalists, very similar to you, were very appreciative, and they also were very critical that why during peacetime or when there's no pandemic, we don't have such access to experts, and why is it only during such a crisis that we're being given this access. So I think that was a very important I think, criticism that for the research community, that we need to really think about, and I think also why public engagement in a sustained and meaningful way is important. All right, any other questions? Yes, please.
Thank you. I think one recurring problem that I face is, I've been told to design for is adherence rate. How can we increase it, or how can we, like, for the uptake of the products that we build. For example, there's one product that we're building, and because there was no uptake, or it was hard for people to get onto it, they sort of repositioned it as an employee benefits program, and so they have, like, there are these different loops you have to jump through. Obviously, like, my personal motivation is to how can, first of all, make products or make med tech that doesn't have to be packaged like this, which also makes it very difficult for people in lower classes to access. So number one, that, and obviously the problem there is as you said, they don't have mobile phones, and or some device now. But yeah, I guess from your experience, what can we do as designers? How can we design, or what factors should we consider in our head while designing products so that they are better, adhered?
I mean, one really quick thing would be to ask the people why they don't want to use the product, and ask as many people as you can why they don't want to use the product. And then you may unravel, like, is it a fundamental kind of design issue in the product? Is it how you're marketing it? Is it who's marketing it? Etc. And also maybe for the team to reflect on how the product was designed. Did it include input from the people that you were hoping would use it? Was there a phase of, like, user testing, acceptability testing, etc.? Yeah, of course. Yeah.
I'm a designer. You talk about NCT, human-centered design, and all that, right?
Yeah.
Step across and all that. Like, we do that. We are, I personally don't think it's that linear, but you do have to test, right? But the realities of, I guess, the corporate world is that you don't get to test that often, and you have to push, and there is a deadline, you have to release, right? And many of the times you don't get access to your user base for legal reasons, or what, IP protection and all of that, you don't. So in that, what practical things can we do? Of course, testing is one thing, right? Even I advocate for it, but
Go ahead. I was just going to say, if the product is inherently not user-centric, it might be tough to think of how to fix that in the aftermath. But
I think we all want to say the same thing, because I can sense we are all. I was going to say exactly what Pattie said, and I totally hear what you're saying, that there's a corporate environment, and when you said that, immediately what came to my head is, you should advocate within the corporate environment that listening to the people, the end user, not just testing. So you are testing a product that you've already designed. Listen more upstream. So that's what we talk about a lot in research. What kind of products do people even want?
Yes.
Is the upstream process. And I think, because I'm also studying business, I'm doing an MBA in Cape Town, so I'm starting to see that you can make a business case for that. And if you can make a business case for that within the corporate environment, that actually, if you consult, not test, it's a language thing, right? Because test sounds like you've already made all of the decisions, you're just doing a quick test with people. But if you actively consult and listen to what people are saying, you may design a product that actually gets taken up better in the long run. And I think there's a business case, a sustainability business case, for certain products to be made like that. So you maybe want to see which segments of the population you're targeting, and are there people that you can consult in the very early stages of product design before testing. Maybe it's a product that people don't want. Maybe they don't want it in the format that you have already designed so far. Now you can't go back because you've already invested all this time in designing. And I understand that corporates don't think that way, but I do think that if you can advocate for that within your team, and start to build a case for why that might be profitable, which is what a corporate wants in the end, I think you may make a business case for sustainability, impact, and profit. And I think that could be a way to work. I know that you're going to say something similar.
No, I think I was just about to say the same thing. Like, Philips needs to have public engagement department.
Yeah. We'll consult if you want. We have a company that.
I mean, yeah. I just wanted to say, the product that you have designed, do the public really need it? Have you done that study at first, or it was from your imagination?
First of all, I understand. Thank you. I think I'm audible. Yes, attach an ROI, and that does translate well in the meeting room. I understand that, right? How do we recruit people? If we do have to run tests, or not just even running a test, even consult and research, right?
You can consult with.
I'm happy to chat with you.
You can consult. She'll tell you all the organizations.
This requires a slightly more deeper conversation. But I actually do want to say something about it, because I think even in research, public engagement is always an afterthought. That okay, now we should engage with the public, and then we realize the public doesn't care, they're not interested, because you're including them at a very late stage of the process. So it's a common criticism that we discuss. It's a common sort of pitfall we continue to discuss even today, and so it's sort of, I can see that it sort of links to your problem too, that we don't invest enough at the start to engage with people that the research or the product is meant for. And so by the end of it, so I'm not saying that your situation is similar to this, but it reminded me of this issue that we face. Yeah.
Can I say one more thing?
Yeah, please.
I think this generalized problem that we are talking about, where end users or communities, underserved communities, marginalized communities, I'm not sure if that's who your product was designed for, but let's call it end users. When we're thinking about the social determinants of health, we're often thinking about marginalized communities, underserved communities. I think it isn't done because it is also a political aspect. There's a politics to it, because if you consult people, you're starting to hand over a little bit of power to them, and I actually don't think power holders want that to happen. So it's not just a case of people haven't thought about doing it. People have thought about doing it, but it's almost like people who are in a position of power don't want to hand over power to the average person. Asking someone and actually taking into consideration what they're saying means you're giving them a little bit of power. And I think there's a politics around not wanting to do that. Not, even if it's unconscious, some people don't even know that they're doing it, so I'm not judging anyone. But there's a political setup that those who hold power make the decisions. And if we ask the average person, we're giving them away some power, and we don't want to do that. We want to hold power. I have to say, even me, I do that in my context. I think it's very difficult to completely democratize and give up power. So yeah, it's political. It's not just like a mechanism thing or having forgotten to do it or not thought about it.
That's a really good point. Any thoughts? Yeah. Give it back to you guys.
Thanks, Tasha, for actually queuing up the question very nicely, because I wanted to ask about epistemic politics. Right?
Yes.
And the way in which we typically talk about public health and public health data, it's usually simplifying something that is complex and finding ways to communicate that to people who have been marginalized historically, socially, and what the work of Woza is doing, and I was so excited that you were here in the panel because I read your work, and is actually transforming how people talk. Even the person that you started this whole panel with, which is how do we, when you think about health, how do you talk about it? Yeah. Right? People talk about health in very, very distinct, embodied, and in the case of anyone who's done work in informal settlements, right, in very relational ways that are important. And yet, public health as a certain field has very disembodied ways of talking about circumstances and people who are often outside of what is normatively the public, right? And I was wondering to what extent you've seen, as a scholar, as a practitioner, a widening of acceptance to, public health stories, and where stories are not different from data. Stories are data, right? And an acceptance of that. Because I think that kind of epistemic injustice part, often we talk about, yes, we need to co-create, but the ability to actually shift the field and, actually bring some critical perspective to how we think about public health knowledge production, that doesn't really happen.
Can I, before you answer that question, no, I'm not going to answer that question. Just for the audience, if you could, because epistemic has come twice in this conversation, so could you perhaps define or explain what that is before you answer?
Epistemic is like the production of knowledge, correct? You can maybe correct me because I'm not a social scientist, so I learned this. It's a word I actually learned maybe 6 months to a year ago. How do we know what we know? How is knowledge produced? So you get epistemic justice, knowledge, epistemic hierarchies. So what we're talking about now, or what we've been talking about in the power situation is, let's say I have a PhD and I'm talking about TB. My knowledge is often valued more than a person living in Khayelitsha whose whole family's had TB. Why is my knowledge valued more? And the person in Khayelitsha who has lived experience of TB way more than I'll ever know, why is their knowledge valued less? So epistemic is how knowledge is produced, figured, whatever. It's a really interesting question. I've actually, in the last 2.5 days that we've been here at Connectors, had this conversation informally with people. When I started doing public engagement work informally in 2013, and we never intended to do this, all these words were never in our framing. It was just like, I was like, these people deserve to know what research is happening and they're not different to any of it. It was just like a feeling for me. My parents were social scientists, so that might have influenced how I view the world. When I started in 2013, no one was doing public engagement. It wasn't a word that people knew about. We were pretty much the only people in Cape Town that really were doing this work. Bean Issues from the Wellcome Trust, Wellcome supported that kind of work in those early days a lot. So they had these international engagement awards, and I mention that because you need resource to build this kind of work. You can't do it without any resource. Now in 2025, there are many other organizations that are doing public engagement. And what's really interesting is I find a lot of researchers coming to us and wanting to do public engagement because they see the value of it. So that question of what kind of data matters and is storytelling important and understanding lived experience. I get people coming for like a range of topics away from TB. So yes, the infectious diseases, but people have come for cancer. I've had as much as, can we talk to people and can you help us talk to people in Khayelitsha about why people don't wear seatbelts, So that's a much further from infectious diseases, and I am seeing, especially among a junior cohort of people, a much bigger desire to engage with people and to understand these things. At the same time, because of the funding cuts that I think everyone is aware of, maybe not the tech people, but the USAID funding cuts, you probably read about them, I think that's threatening that progress. Because what is happening is the public, when donors and institutions look at what money they've got, very often they they don't put public engagement at the top. So funding is drying up. It's drying up for everything, but it's drying up at a moment where I feel the importance and the cultural awareness within the sector of public engagement is really starting to happen. And so it's really sad because it might mean that might not continue because the visibility decreases. But yeah, in the 13 years or whatever it is, 10 years, 12 years, it's changed a lot. And I think that's younger people coming up. And it's an ecosystem thing. Wellcome played a big role, others have played a big role, people working in different places. I don't know if the other panelists have a reflection. No? Yeah, that's...
I have a few straight thoughts that I relate, so they might not fit in the straight bounds of the topic here. But one of the points you made was that public engagement comes in very late in research as well. It's not conceptualized right at the beginning when the project is being conceptualized. So since I'm in an institution that does a lot of work, lab-based research, some of it of course is quite fundamental, but we do have a lot of translational applications and things that directly link into understanding diseases and other things. How do I go to a PI and sort of tell them, somebody who's running a lab, that this is something you need to think of when you're writing a grant application, or call me on day one, rather than when a paper gets published and send me a link that please advertise, or please publicize this. So what's the way to go about that?
That's a really good question. And who would like to get?
Yeah, thank you so much for your question. Again, I would like to start off with my experience. So when I first joined my institution for public engagement, the researchers, they used to think public engagement as event managers. So we were supposed to cater materials for the trainings. We would support them with arranging chairs, make sure the catering is good, if there are enough food or not. So that has changed over the past 8 years, I think, since a few of the funders make it stringent that they need to have public engagement while applying for funding, especially when it's UK-based fundings. So now slowly researchers have started to realize what public engagement, the importance of public engagement as well. And plus, I think it's not a one-day process that, okay, today researchers will start giving importance to public engagement. I think it's a gradual process, and we as public engagement practitioners, we need to advocate it regularly to make that happen. So now with things changed, like 8 years ago I was looked upon as event manager, whereas now the PIs, when they start writing proposals, they come and they have me as public engagement manager. They ask for my opinions, like, I'm writing so and so research project, what are your plans, how would you like to support the research, because I see public engagement as a supporting team to the researchers, especially while working for a clinical research unit. So yeah, it is not a one-day process, but it's a gradual process, and lots of advocacy is required, and especially if funders also put in that criteria, I think the researchers will also realize the importance of public engagement. Yeah.
Can I add one thing, because I see this in my research institution? Make it easy for them, because researchers are very overwhelmed all the time. I'm sure it's the same everywhere. Are very busy, very overwhelmed, hustling and competing for grants. So if you can do one small project and make it easy, don't overburden, don't make your PI, if you're asking for yourself, don't make them do the work. Go out and do the work and show him how cool it is. And then show him, again, it's almost like a business case, but don't ask him to do anything, because if he doesn't already believe in public engagement, he's not going to do it. But if you do it for him and you show him how much it improves the research or how much your lab team is enriched by it, then you'll start to unlock. It's a slow process. You'll start to unlock something. So I see that a lot in my institute. When the researchers are asked to do it, they're like, well, we don't know how to do this, and we've got so much to do, and I've got grants to write. And then slowly you open their minds, and the next minute they're in Kailicha giving talks. Yeah.
I just had a kind of comment on that. I mean, there's a certain kind of the idea that public engagement is incorporated in a very kind of constitutive way into grants is a very welcome development, but there's also a certain kind of disingenuousness built into it, because you want more inductive research to happen. But most grants require you to have established these relationships and projects, right, before you actually develop that, in the development of that proposal. There is absolutely no funding for building those relationships and building that kind of inductive
Yes.
Because they don't really, you have to somehow or the other shoehorn inductive participatory research into formats and protocols that are not about that at all, right? And kinds of, and I'm just seeing the ways in which all of you are nodding. I mean, you're all extraordinarily then familiar with the kinds of contortions you have to get into in order to develop a way to communicate to an institution ethics board that thinks about health research in very, very kind of narrow ways, to think about what would it mean to look at public health research where public engagement is front and center, right? So the, kind of those 2 points that I read, one is the investment of trust through which you actually come to a proposal that you can develop is something that is unfunded, invisibilized, and completely unvetted.
You haven't seen returns on that.
Correct, right? So that's all kind of the framework that is supposed to actually do. And of course the institutional ethics.
Yeah, I think that's a really good point, and I feel that I think some of the programs, projects that Pattie you have done and Sangat with Vikram have very deftly integrated engagement, or engagement is part of the research program. So maybe talk a bit about how that was done. And
just an example, and again I will say, this is something that works with some funders, and I'll give you one example of a currently open call as well. So one way of integrating where the engagement is not just about the activity, it is embedded in the process. Is when, I'll give you an example of a trial we're running right now. It's a 5-year trial. We started writing it up in 2011 or 12, 21 or 22. The investigator team includes people who have lived experience, who are advocates themselves. They're not trained, it's kind of traditionally trained researchers. There are also traditionally trained researchers in the group. That's one level where there's that leadership. There's a community advisory board whose job is though to advise on governance, on the program structure, etc. We did one year long study as part of this trial, like a pre-study to the trial, where we kind of adapted some of the interventions, materials, etc. that were for use in the trial with another much larger cohort of end users. Because of the way that this intervention is structured, it is also delivered by non-specialists. So the people who are actually the delivery agents were also, we were able to work quite closely with them to train them, etc. And they're part of the same community who the service is being offered to, which is college students. And we also work with training a few students from different colleges on kind of basic research skills. They will be part of the data collection process towards the end as part of also a process evaluation. So it's looking beyond the kind of quantitative stuff. There's a large process evaluation embedded in this trial. So our goal in this was to see, can we embed this kind of approach to involvement rather than, I call it involvement, at each part of the life cycle of a trial or a kind of traditional sort of research study. I'm not saying that it's perfectly done, but the attempt was to have it at each stage. And we built this engagement or involvement stream as something that starts on day 0 of the program and it ends on the last day of the program. It wasn't a single activity, and it was the first one. So it's at the engagement is the first thing. So we're going to take 6 months to build the relationships, 6 months to sign the MOUs, and again, all of you must know very well how hard it is to get people to actually agree to work with you in general. And they were amenable and agreed to give us this like almost a year and a half of what we call setup time. So setting up the interventions, designing things, redoing things, building these relationships with the people that, or the institutions we plan to work with. Again, I'm not suggesting that everyone is amenable to this kind of a timeline or giving you costs to do a setup phase as well. But some funders are. There's a new call, again coincidentally it's a welcome call, and it's really interestingly structured because they are not actually funding anyone past 12 months. So it's 12 months to do a foundation to set up what otherwise would be a 5 to 7 year implementation science study on people who are working on depression, anxiety and psychosis. But it's the first call of its kind where we've seen this dedicated setup phase. They want you to spend a year getting the best partnerships in place, setting up your the sites where you plan to work, etc. And they're not even funding you to start doing any work till the 13th month. And they're saying if you don't do a good job in the first 12 months, you may not fund the scale up or whatever the implementation part. So there is this shift that's happening. Again, I think some sectors are a little bit ahead of it because I think the involvement mindset shift is happening more there. But these are, I will say, they're outlier, kind of exemplar examples. This is not the norm, but it is happening. And again, we have a lot of literature published on kind of at least many of the first steps of what I mentioned. If it's helpful to share, we're happy to pass that kind of information on. Yeah. Anyone want to add anything? Sorry, I know we're really out of time.
All right. And I just wanted to quickly respond to your question because I think I completely feel your pain. But what I have tried to do in my work is divide researchers in 3 categories. They're not a homogeneous group. So there's one category which is very, very supportive, proactive of public engagement. There's the middle category which is sort of there, not quite. And then the third one, like we don't have time, we are not interested. I don't think public engagement is important. So I've always tried to engage more with the first 2 categories. And actually, usually you will see very young researchers in the first category. And I think that is where I feel we need to engage more because it's not just about present, it's about the future. So instead of engaging with really senior scientists and PIs and telling them why it's important, I would much rather use my time and energy to engage, support and nurture interests in younger researchers. So just yes, just so that it's not all doom and gloom. I think you can just change your strategy and make it work for your context. Yes, and so we are almost at the end of this wonderful discussion. Really would like to thank the panelists for sharing wonderful experiences and also for the audience for these important questions as well. I think I would just like to end by asking this question around, and I think you've sort of touched upon it through the course of the discussion, but what does success in public engagement in health look like for you? If you have to explain it briefly, how would you define it? What does success for you look like? Not for the program, not for the project, not for anyone else, but for you.
I think I've said it in like long ways, yes. But I would say I really think it's when the people that you're trying to serve are seen and heard, and they think that they've been seen and heard, and they feel that. I think then you're maybe doing a good job with the public engagement.
Great.
I was going to say something very similar. On a personal level, I feel most happy and most comfortable when I have the freedom to truly engage the community, because as you were saying, there are many structures that prevent that, and so sometimes we have to make compromises to keep going and to keep the work going. But there's some projects where I'm like really free and we can do cool work, and that's when I feel like I'm at my best and it's most successful.
Yeah, so not a very difficult question to answer, but not easy to answer as well. So for me, success for public engagement is something like we've recently established a community advisory board for our research unit in Nepal, and then we've established to make the research we do very inclusive and equity, and we kind of have started distributing the informed consent and participant information sheet to those CAB members so that they review those participant information sheet and give us feedback to make sure that that it's easily understandable by the community or the end user. So going back to the question, what success is when we are able to incorporate the changes or the feedback given by the CAB members in our informed consent, I think that would really mean success to me, and I think that's when that means the researchers are also welcoming them, and that's when the work of public engagement is kind of done. Yeah, thank you.
Thank you so much. I think, did you want to add something, Tasha? No, okay. I think like Pattie said earlier, that pandemic has put a spotlight on why engaging with public is so important. I think to your point that, how did we respond to the pandemic? How did we engage with journalists during the pandemic, or how did we communicate during the pandemic? And I think it's very clear that to solve health challenges, we don't just need better data or smarter technologies, but we really need to build more connections and more collaborations across sectors, across disciplines. And I think for that we require really intentional, meaningful engagement and communication. And I think a lot of the challenges that you've all discussed, I think there are no easy answers or solutions, but I think a lot of the work that we are all doing is work in progress, and I think there's a lot we can do by talking to each other and learning from each other. So I'm really grateful to the gallery for organizing this discussion, because I think you exemplify connections and collaborations. You bring really unusual people to the gallery for to talk about important issues, and I hope that this discussion was one such dialogue that will make us think more deeply about public engagement and health. So thank you all of you, and thank you to the wonderful panelists.